Did you know the way you pack a wound can be the difference between life or slow healing? Today, I'm showing you two essential wound packing techniques, one to stop a bleed immediately and one for chronic wounds that need gentle care. Hi, I'm Alyssa, a nurse who specializes in wound care. In today's video, we're covering two methods of how to pack a wound properly and when to use each method. I'll first start by showing you how to pack a bleeding wound tightly to control the bleed. Then I'll show you how to lightly fluff a chronic wound to promote healing. We'll break down each step so you understand the reasoning behind every move. Before we start, safety first, always use your gloves. Keep everything sterile and know that tight packing isn't for every wound, only for active bleeds. Chronic wounds need gentle care to avoid further tissue damage. When a wound is bleeding heavily, you need to apply direct pressure inside of the wound using gauze strips and pack tightly, filling every corner of the wound cavity. This helps stop the bleed and give the vessels something to compress against. Here are the steps. Grab sterile gauze. Place the tip of the gauze directly into the deepest part of the wound. Push firmly but carefully until the cavity is completely filled. Apply compression dressing on top to maintain pressure if you have one, or hold pressure until emergency services have arrived. Now, chronic wounds like pressure injuries or slow healing ulcers, they need light, gentle packing. We don't want to compress blood vessels. We just want to fill the dead space and absorb the drainage. You're going to be a lot more cautious in making sure that you use sterile technique. Here are the steps to follow. Take your packing and lightly fluff it into the wound, almost like you're sliding it in rather than pushing it in. Fill the cavity without pressure, just enough to support healing. Notice the difference? No tight compression, just gentle support for proper drainage and tissue repair. Light packing allows healthy tissues to grow and fill in the dead space. To recap, bleeding wounds use firm, deep packing and a pressure dressing. With chronic wounds, we fluff the packing, never stuff, and use a gentle cover dressing. Understanding the type of wound is critical. Packing too tight in a chronic wound can actually delay healing or cause the wound to get larger. Not packing a bleeding wound correctly can be life-threatening. If you found this video helpful, make sure to hit the like and subscribe button for more wound care tips. And remember, proper packing technique can make all the difference in stopping a bleed or helping a chronic wound heal safely. This wound packing trainer I used for this video is available through the link in the description. If you choose to purchase through my link, I do receive a small commission at no extra cost to you. It does help support my channel so I can keep making educational content like this. Happy healing. Head to thewoundconsultant.com for expert wound care consultations, practical guides, and educational books, your go-to resource for smarter wound healing.